The national implementation of PAWI, a post-anesthesia workload instrument, is essential for the objective measurement of nursing workload in post-operative care units. Over 600,000 surgical procedures are carried out in Sweden every year. High nursing workload increases the likelihood of nursing and medical errors. Therefore, measuring nursing workload helps to improve the quality of care. PAWI is validated for adults over 18 years of age, but not for children. Patients have several care needs post-operatively. These can be measured in 11 domains. Respiration, circulation or bleeding, elimination, gastrointestinal, nutrition, PONV, CNS, pain, medications, tests, examinations, nursing care, activity, skin, tissue, communication, contacts, administration, documentation. PAWI measures nursing workload by the specific activities carried out by nursing staff. The work of nursing care is objectively demonstrated. Specific activities are graded on a 5-point scale, with 5 points indicating highest workload and 1 point indicating lowest workload. PAWI registration is done at the end of each shift, day, evening and night, by the nurse responsible for the patient. The highest number of points within each domain is registered. If more than 3 specific activities are registered within a domain, this generates 1 extra point. The maximum number of points in PAWI is 55 per shift. Meet Kim. She has just undergone hip fracture surgery under spinal anesthesia. She is on home CPAP. It is now time for her to leave the PACU and PAWI should be registered. Kim's home CPAP was used post-operatively in the PACU. In the respiration domain, home CPAP generates 3 points. Kim has a stable blood pressure and pulse rate. She is warm, has normal color, and sensation in the lower limbs is normal. Within the circulation bleeding domain, this gives 2 points. A bladder scan was performed twice post-operatively, showing 300 milliliters of urine at the time of discharge. Within the elimination domain, a bladder scan once to twice generates 1 point. Kim is overweight with a BMI of 36. Within the domain GI, nutrition, PONV, BMI greater than 35 gives 2 points. Kim is awake and alert. Her Bromage score is 0. Within the CNS domain, Bromage scoring generates 2 points. Kim experienced breakthrough pain with an NRS score of 7. She had a good response to 2 doses of IV opioids. Within the pain domain, NRS 7 to 8 generates 4 points. In the domain medication, 2 to 4 intravenous injections generates 2 points. Her temperature was 37.5 degrees. Within the tests examinations domain, this activity scores 1 point. Inspection of wound dressings and bandages was unremarkable. Within the domain nursing care, activity, skin, tissue, this activity generates 1 point. There is a delay of 45 minutes before the patient is collected by staff from the surgical ward. In the communication contacts domain, delays of greater than 30 minutes generate 3 points. Admission and discharge notes, as well as other data documentation, is completed. Within the administration documentation domain, this generates 4 points because of the large amount of time it takes to read and register. In total, 25 of a maximum 55 points are registered. PAWI may lead to positive effects for patients and healthcare systems. Every patient is unique and has the right to individualized nursing care. PAWI measures patient-centered activities that may lead to improvements in the delivery of nursing care. Objective measurements increase awareness of the quantity and quality of care. This may in turn help reduce post-operative complications. PAWI points may indicate how resources can be best allocated, which may benefit patients, healthcare workers, and improve the work environment. PAWI is nationally validated and measurements are uploaded to the Swedish Perioperative Registry, SPOR. Read more about PAWI in the European Journal of Anesthesiology.